Hi, this is Sam from Ketoacidosis. Welcome back to my YouTube channel. Today's topic is diabetes, and this is second part of the video series when we will talk about different types of diabetes and their characteristics. Let's do a quick comparison between type 1 and type 2 diabetes based on various features. First, onset. Type 1 has a sudden onset, while type 2 has a gradual onset because it's a lifestyle diabetes. We will go in detail of both forms eventually. Then age of onset, which is a very common question all the time to confuse us or to give us a hint which type of diabetes they are going to ask us about, is going to be type 1 has mostly in children, type 2 is mostly in adults. Body size of a type 1 person would be thin and normal, while type 2 person would be more obese. Ketoacidosis is more common and classic of type 1 diabetes and is very rare in type 2 diabetes. Autoantibodies in type 1 usually present in type 1 while absent in type 2. There is endogenous insulin level which is low or absent in type 1 and is normal, increase or decrease depending on various circumstances in type 2, but low or absent in type 1. That's the more common concept which you'll be tested on. And prevalence is only 10% of your patient population or general population outside would have type 1 diabetes. So you have to, whenever you have a chance to assume the type of diabetes, you will more likely to be inclined towards type 2 diabetes because it's 90% prevalent. Now let's dive into detail about type 1 and type 2 diabetes. So when we are talking about type 1 diabetes or insulin dependent diabetes, it is due to autoimmune destruction of insulin producing beta cells of pancreas. It usually occurs in children and adolescents and usually leads to absolute insulin deficiency. The high incidence of complications like ketoacidosis is associated with type 1 diabetes mellitus. What is ketoacidosis? Let's learn about it. Ketoacidosis is when the liver begins to break down fat and protein since it feels like there is a perceived lack of glucose around in the body. And when liver breaks down fat and protein, then it results in acetone byproduct, which also results in acetone breath. There is dehydration because there is excess urination and there is glucose in the urine, which brings all the water along due to osmosis. And there's also cosmal breathing, which is a very, very common topic, very, very important question for all board exams. Cosmal breathing is classic of ketoacidosis and type 1 diabetes, which is labored, deep, and gasping type of breathing. Also, patient would have some confusion, brain damage, which may eventually lead to coma and death. The diagnosis of ketoacidosis is made via lab test, and you would find out that there is severe acidosis and a large amount of ketones in the blood as well as in the urine. What is treatment of ketoacidosis? You have to give the patient fluid and electrolyte replacement and also correct hyperglycemia, which is the principal cause of this excess ketone production. And I think we covered quite a lot about type 1 diabetes. Let's jump on type 2 diabetes mellitus or non-insulin dependent diabetes. So it is most commonly seen in adults or it has adult onset, and it is due to impaired insulin function or insulin resistance. You would like to note that it is more of qualitative of insulin rather than quantitative. Quantitative would be type 1 when there is reduced quantity or no insulin being produced, while qualitative is when insulin resistance or absorption of insulin is compromised. It is more commonly related with obese people, and the complication, just like in type 1 it was ketoacidosis, in type 2 it is going to be hyperosmolar non-ketotic acidosis or HONK, HONK. Ketoacidosis is uncommon in type 2 diabetes, so just try to dive deeper into HONK in the next part of this video. So HONK or hyperosmolar non-ketotic acidosis is another favorite topic of national boards these days. There you will see dehydration, acidosis, hyperglycemia. You will see some small amount of ketoacidosis as well as some neurologic changes in this condition. Treatment for HONK is going to be similar for what we learned for ketoacidosis. It's fluid replacement, electrolyte replacement, and correction of the hyperglycemia. Another important point for type 2 diabetes mellitus is it is often asymptomatic. That means you would not know when there is an onset of diabetes. So a regular screening every 3 years with fasting blood glucose is recommended for all patients, especially patients at higher risk due to their increased body weight or due to any other conditions that they have. Diabetes must be kept on watch for all patients these days due to our lifestyle. And these are all the key points about diabetes types. And in the next video, we will talk about complications in diabetes, which is another favorite topic of national board exams. So just follow along this playlist. This is part 2. We are moving to the part 3 with complications in the next video. Make sure you subscribe to my channel because I'm really looking for some subscribers. Share this with a friend and also hit that like button so I know that you enjoyed this video. Post in the comment below what are the questions you have and what other topics would you like me to cover. In this way, is this format of video and lecture effective for you, helpful for you? Please let me know in the comment section below. Thank you so much and bye-bye.